Lovely to see everybody here today. I'm Matt Williams. I'm Senior Programme Manager for Mental Health of the Oxford Academic Health Science Network. I said it all in one breath. This is my colleague Lauren. It's really nice to see so many of sort of faces we've met as part of our journey. We're going to talk about a report that we did published last year. And I'm just going to set a bit of context about it. So we were approached by the BOB, Buckinghamshire, Oxfordshire and Berkshire West integrated care system, who, like many people, as Chris alluded to, are concerned about the number, the pressure on CAMHS services, waiting times and what have you, and appreciating that digital is one aspect that might help with that, not as a replacement for skilled clinicians, but as an adjunct to that work. And there's just a little sort of example of our patch there, which we cover, and I hope that's helpful. And it really is. I'm just going to rattle through this because I think it just sets it into context in terms of what we're looking at in terms of our landscape and future, what we can do while young people are waiting for treatment. Offer a variety of choice. This isn't digital for digital's sake, and I think if it had been, we wouldn't have been interested in this project. But we really wanted to see what we could do as an academic health science network. We're one of a number, about 15 across the country, and Kent, Surrey and Sussex did that report, which Chris showed as well, to look at what's available within the Thrive model. The Thrive model gives it a kind of a hook to hang this on, and see what the tools can, what's out there, essentially, is what they wanted to know. What evidence is there for that? How unique are each of these products, and what have you. We'll tell you a little bit more about that, and to really test this idea with clinicians and young people, because you can have the most fantastic digital solution out there, but if clinicians don't find it useful or user-friendly, or young people and their parents don't find it engaging or user-friendly, well, you've wasted all your times and that opportunity. So I'm just going to park it there. That's quick,
over
isn't it?
To me.
And over to you, Lauren. There you go.
Thank you. Hi everybody, so I'm Lauren Fensome. I also work at the AHSN with Matt, but I work in clinical innovation and adoption, so I'm the digital lead. So we kind of came together on this project along with a couple of colleagues as well, so you might know Fran Butler and Hayley Truman as well, who work with us. So really just to give you an overview of our approach. So as Matt's already said, what we wanted to do was to identify what was already being used across the patch, which is the BOB patch, and work out then also what was available or what other people were using in other places across the country as well. So there was two things that we did. We went out to our contacts across the region, and we asked them, well, what technology are you using? What do you like? What do you not like? And we tried to pull that together. We then went out to our AHSN contacts. So if you don't know already about the AHSNs, we're one of 15, so it's a big network across the country, and we're regionally based. So we went out to all of our other AHSN contacts. KSS, Kent, Surrey, Sussex were particularly helpful around some of the work that they'd already done. So had they had any experience of getting some of these digital innovations for children's mental health into practice? Had they had any experience with scaling them and any experience with any of the research? So we did all of that, and then me, being the digital geek, went away and Googled everything and pulled everything into one place. So we ended up with a massive spreadsheet, as you can imagine, of, I think there was more than 60 solutions when we started off. And we just went, look, we've got everything here. We really need to focus our efforts. What are the issues that we're trying to address? And that's when we came back to the Thrive model, and we were thinking, right, let's section this out now, and let's work out which bits of kit can support which parts of the child's journey. And we worked in that way. A big thing for us was to make sure that these products were ready to be scaled, so they were ready to be adopted. So they already had enough evidence behind them, whether that was a clinical trial or real world evidence behind them, so that somebody could literally just go, right, we know that meets our needs, we know there's evidence, it's been piloted here, there and everywhere, we can move with that, we can run with that. So that was one of our sort of criterias. And after that, we refined it down to about 28. I think there's 30 in the report, so it's kind of moving as we go. And I think that's another really important point. As soon as that was published, it was out of date. So it is a moving beast. All these tools are developing all the time. There's new suppliers to market all the time. So we've really got to be conscious around that as well. So once we got these solutions together, we then thought, well, let's do some clinical engagement and see, we've got this big list. How can we help you in services? What are the next steps? We've found these. How can we actually go to get them procured? What are you looking for in service? So we did a couple of clinical engagement sessions, and we also attended a couple of youth boards as well to find out exactly what people were wanting, the service users were actually wanting as well. And that kind of culminated in a PDF report, an online report being published towards the end of last year, and we've had some really good response to that as well. So just to give you an overview of the kind of things that we asked in the clinical engagement sessions. So we were asking, and we did two of these sessions. We spoke to about 18 people across 2 sessions. So this was across the region. And we looked at, what digital products are you already using? How do you feel about them? So, we're trying to remove the barriers to adoption as well. So if there's anything that you're concerned about, we were trying to highlight that there. And it seemed to be overwhelmingly so that people do want to use them, but they're just not really sure where to start. They might be using a few digital solutions, but they realise there's a big there's an opportunity there. So overwhelmingly so, we know there's a need for it, and there is the need to actually adopt as well. It's not just a kind of over here kind of blue sky thinking thing. There's a need for it to happen right now. Where's the greatest needs in the CAMHS pathway? So this again helped us to refine the report a little bit, and looking at, where do we think you'll get the most bang for your buck, so to speak, with these digital technologies being implemented. And as you can see there, it's a lot of them were kind of saying it's really all the way through. It depends, what part of the pathway the patient's on, obviously, but we do need something all the way through. And I think that's where sort of the solutions like Mayden, which are connecting some of the system together, and some of the other products that we looked at are really important. Another really good sort of idea that we looked at was the Best for You platform, which is a kind of ORCA-backed website which has everything that you need. So you can kind of go to there and you can look at exactly what you need for your part of the pathway and what you want to address. So we got some really good feedback, and I think this one's particularly interesting. But we can, if you want any more information on what the barriers were, please do come and talk to us. So I think one of the roles of the AHSN particularly is where that something is a good product, but you might not necessarily have all the evidence, or you might not have the health economics to go along with that. That's something that certainly the AHSN can help you with. So if there's anything like that you need, then please do come and talk to us. But yeah, I think the biggest barrier we found was the procurement process, wasn't it? And certainly that's something that we can help with, business case writing and that kind of stuff. So if you need any support around that, please do let us know. So what are the next steps? We did think that, as I said, this kind of library of options, which would be a good idea. Ongoing training and support and clinical leadership was the sort of headline things that we found were coming out of the clinical engagement sessions. And from the youth boards, and there was some interesting conversations around this as well, wasn't there, Matt? So they were concerned that, with a lot of these apps, they're asked for a lot of information before they can even get access to anything. And what is happening with that information? So there needs to be, I guess, a little bit more transparency around some of that as well. There's a lot of apps available. I mean, if you Google or if you go into your app store and put in mental health, I think there's thousands and thousands of apps. It's about, which ones are best. And that's, again, coming back to this kind of one-stop shop, whereas a trust, you might pick some of the solutions that you think they're evidence-based, that you've used them before, you're happy with them, and they're in almost like this repository that you can signpost people to, so they haven't got to go away and do all of that for themselves. And the interesting thing as well was some of the apps that were just kind of off the App Store. Some of the tone that they were using was a little bit patronising sometimes, you know, so it was almost clear to a lot of the people that we spoke to that they hadn't engaged with kids or young people at all when they developed these, and they kind of just presumed that this is how they wanted to be spoken to. So Matt, do you want next one?
Yeah,
learning points.
And just on that point about, you know, the young people sort of said, you know, if somebody tells me that my mental health is important, I'm going to scream. You know, I think it's sort of self-evident, and young people aren't daft, and I think they often felt that some of the digital solutions offered to them kind of treated them like they were. So I think that's really important about co-production. So I think, you know, having done this collaborative approach, that's really good. I'd like to continue this dialogue. You know, a number of you with stalls out there are part of the report. And I think that for us, you know, we engaged in this piece of work expecting to kind of have a boundaried piece of work. What is out there at the moment? You know, let's get some clarity. Let's kind of fence it in. Actually, the truth is that everyone we spoke to pretty much, and I'm sure there'll be some nods of agreement here, is that to some extent people said, don't get the off the shelf. We want to work with you to develop new products. So suddenly from being something which was tightly boundaried, it suddenly became a lot more exciting, a lot more complicated, but I think that's a really key thing for the NHS to be aware of, that actually there is an offer there to develop something bespoke, and that's how change will happen. And also, you know, we all know about digital inequality, that, you know, we can get so enthralled to the new and the shiny that we actually can sidestep that, and there are equalities issues that need to be there around internet availability and what have you, and I think we have to acknowledge that as some people's reality. And then in terms of recommendations and next steps, you know, digital leads. I think that's the key thing, is that you can have services. We spoke to some clinicians who really love digital, they're really switched on to digital, but they're not in every single team. So you need somebody who can be identified as a clinical champion, but also a digital champion, to really bang the drum, to be the go-to person, to be able to respond to that when somebody goes, I've no idea how, you know, this is technical, that's your stuff. Somebody needs to be on the spot to give people to be able to do that. Trust is vital. I think a single, you know, interoperable digital pathway would be our dream outcome, rather than little bits here and there. And Daedalus in Staffordshire, isn't it, is an example where that approach might come into place. But I think it's about easy to follow processes within trusts. As Lauren said, it's procurement. Procurement's a huge barrier, as are the language that we use, the language that clinicians use, the language that digital innovators use. There are all sorts of issues there, and I think it's removing that necessity to run and rerun pilots. So many, don't we? We roll something out in one area and we go, it's brilliant, we've got all of this great data, and then it stops being funded, and at worst, that digital product sort of languishes and is left and then becomes dangerous, or we have to rerun the pilot again and again, and we do it from boom to bust.
Yeah, and you know, you might have neighbouring trusts that both want to run a pilot, and they've got exactly the same geography and exactly the same demographic, and it halts development for the technology, you know, the people who are actually developing this, and it just extends timelines everywhere, and it stops the people who actually need to use the technology using it. So I think that was something that was a real big takeaway for us, wasn't it? That we were always going, yeah, we can run a pilot, and actually it's not always that productive, although it's a nice thing to do. You know, there's lots of evidence out there already, really. So.
And we are happy to run real-world pilots. You know, I mean, I'm not talk ourselves out of business, but it's just being aware of that. The system needs to be aware that doing it little bit by little bit isn't going to change the dial sufficiently, and actually there's some quite radical changes that are needed. But that perhaps is for another conference. So I'm going to stop there, because I'm aware we want Kathy to come up and give her presentation. But thank you for your time and your attention. Laura and I will be about. Grab us over lunch. I know we're meeting a couple of you, and we will honour those. But if other people want to, if we sparked any ideas, come and chat. And this is something we're really interested in. So thank you very much for your time and attention.